so much for joining our interview series, Real Stories of Strength and Resilience. It's really great to meet you. My name is Meghan Murphy. I'm the Senior Coordinator of Marketing and Social Media at Health Monitor Network.
Hi, Carly. It's so nice to meet you. I'm so glad that you can join us today for our interview. My name is Joana Mangune, and I am the Editorial Manager at Health Monitor.
Pleasure to meet you both. Obviously, I'm Carley Hartings, and I'm here to share my story about dealing with IBS-C.
Yeah, thank you. We really appreciate your time, and we're looking forward to discussing your health journey after being diagnosed with IBS-C. So we'll just jump into some questions.
Let's start with the basics. When your GI issues started in 2014, what did you initially think was causing your symptoms? And can you tell us more about what you experienced in the beginning?
I didn't know exactly. In the beginning, like I said in the interview for the written material, I was dealing with an eating disorder. And so there were a host of issues that I was trying to untangle. And mental health, of course, was one. Reestablishing a healthy weight was another. And in the mix of all of that were my intestinal issues, essentially.
Right.
I was not so much to the point with the eating disorder where I had to overcome what's considered refeeding, where my stomach just did not know how to deal with food at all because of restricting so much. But I did experience a significant amount of bloating, obviously the constipation, and that would have a marked impact on my mental health, because it would just throw off red flags to my eating disorder, that I was fat and just all of the negative thoughts that come along with that, when it absolutely was not true. I just had irritation or inflammation in my intestinal tract that was causing all of that to happen, and it was having psychological impacts, and it was just a vicious cycle.
Right. So yeah, you mentioned in your story that, you trained your body to listen to hunger cues, right? So tell us more about that. How did you work on that?
Yeah, I went through a treatment program that kind of helped to reset my body's experience of the amount and timing of food that I should be eating. And I say should, just what is regular and most healthy in terms of 3 meals a day or something like that. Now, it doesn't have to be that strict, but it was, like I said, a reset. So it just kind of implemented something new for my body to experience. And that also kind of helped me become aware of my intestinal issues, because from that point on, I was not in a weight loss journey. I was in a healing journey.
Right.
And so my perspective completely changed. It became, okay, what is really going on here? Whose professional input do I need?
Right.
And what do I need to do to treat this?
I know that makes a lot of sense. And you mentioned in your Health Monitor Living interview that you went through multiple tests and procedures. Can you tell us about how this point of uncertainty really affected you emotionally and mentally?
It's incredibly discouraging. I have learned through the process that I would call it arduous, because it requires a lot of stamina and tenacity kind of to get to the bottom of something when there's no answer right away. So yeah, it's very frustrating. It made me feel even things that I'm trying to figure out now, unseen and kind of alone on an island. And so it's a stress. It's a stress for sure.
Yeah, I totally get that. It's really frustrating when you don't know the answers, right? So earlier you mentioned that, once you found like your own healthcare team, right? Then
Mhm.
that's when the healing process started to begin. So tell us more about how you found your team. How did, who was the first person that, that you talked to?
Absolutely. I think for me, again and again, mutual understanding is like the key to the kingdom. So I needed to, and this was part of why I'm here today, but talking to people about what's going on with me helped me to find those healthcare providers that could give me the answers I was looking for. The GI physician that actually diagnosed me with IBS-C was referred by a friend who I talked to about it, that I met in a support group.
Right.
And I think just being among people dealing with the same thing shares so much beneficial information, and just being open with it, for sure.
Right. So speaking of treatments, I think you mentioned that you turned to over-the-counter laxatives for relief at first, right? So
I
how did
did.
this approach affect your health and well-being? And, how did you finally find the treatment that worked for you?
Yeah, it wasn't sustainable. It wasn't. And I tried like excessive amounts of dietary fiber and different things, that I was told were good. It's good for everybody else, might not be good for me, and vice versa. So it was difficult to turn off information that I was receiving just, in the general media. So I went to different doctors. First, I just started with a general, gastrointestinal physician. I had colonoscopy. I swallowed a pill with alphabet letters and went and got a CT scan every day to see where they were at in my intestinal tract at that point every day, and just really started, throwing darts at the wall and seeing what would
Right.
stick, what would give me any kind of information. And then if there was some kind of glimmer, of information that I could derive out of that, then taking it and digging deeper. Um, so that's kind of how it went for me.
Yeah, so it sounds like, you did a lot of trial and error and you
Mm-hmm.
really persevered. It seemed like you had to like go through a lot of process. So what advice would you give to someone who's kind of like, like this is a lot. This is a lot to like, process. Like what would your advice for someone?
Yeah, it is a lot. And it's really difficult when I'll speak for myself, when I'm stuck in my own body and my own body is not happy.
Right.
So, whatever issue it is, if there's something going on, it's so difficult not to, fall into that becoming my reality, with my eating disorder and whatnot, and any challenge, actually, including the IBS-C. Like when I feel bad, I think I am bad. And so it has really, kind of deep-seated self-esteem impacts that just feed on, what's already there for me. And my advice is reach out for help. It's a very scary thing, but if there are groups or other people around you that are going through the same thing, reach out to them, see what has worked, what hasn't. It's one of those take what you like, leave the rest sort of scenarios, but there is helpful information in that. So just, gathering it, and being, persistent.
And I think that's what a lot of what we at Health Monitor want to do is empower patients to tell their stories, because from patients like yourself, we've heard that hearing other people's stories makes them feel a lot less alone on these journeys. I kind of want to pivot a bit, because I know you're a very active person and you mentioned that you love hiking and working out. So how did your symptoms from IBS-C either before or after you were diagnosed affect your ability to enjoy those activities that you love?
Yeah, it would be debilitating. It would be like
Right.
the cramps. I, I can run a half marathon one day, but then when the symptoms are there and raging, I can't stand up straight.
Right.
It would just be, like I said, debilitating. And there was really nothing that I could do to make it go away. I think what the medication I take now does helps to prevent it from even starting a lot, which is phenomenal. But yeah, before I got to this point, it would just stop me in my tracks, and I couldn't do anything.
I can't even imagine like going hiking and, like just having like a flare up right in the middle of a hike. And it's like, where do you go? Right. So I'm glad that you finally found a treatment that works for you. So earlier you mentioned that, having a good support system when dealing with a chronic condition like IBS-C is, very important. So how did you find your people? How did you find your support system, and, how have they helped you?
I would say that a lot of that came through being vulnerable with other challenges in my life. So for me, when I reached out for support with my eating disorder, lo and behold, a lot of the other girls or guys were dealing with those same issues. And it's not a surprise. So if somebody is struggling with intestinal issues, maybe look for the zebra, like what else is going on. And if I'm not getting anywhere here, maybe just like you said in the questions, pivot and try and work on this area, and there might be some answers that speak to the other issue.
Yeah, so IBS-C isn't something that's easy to talk about. It's not something that you just open up right away, right? So what's your advice for someone who's having a hard time opening about their diagnosis?
I would say, in my mind, the lowest threshold or the easiest hurdle to cross is to go to the providers that live inside of it every day, because I guarantee you they've seen worse, they've experienced worse, and they're not going to be grossed out by it. They live their lives in it. So that's kind of the easiest place to start for me. Oftentimes, I will see who is being vulnerable around me. So it's one of those just kind of basic human interaction kind of exchanges. So if somebody says something vulnerable to me, I can share back with another vulnerability of mine, and kind of go from there.
Tell us more about your social media, right? So how did you start? Yeah, so how did you, I think we found you on Instagram, but how did you start your Instagram? Did you already have an account before or after, or did you, say, hey, I'm going to create, an account so I can, reach out to others?
So I think I'm trying to remember if I had an account previously or if I like closed it in advance and started one again. It was 2016. I remember when I started my page specifically related to eating disorders. So essentially, as soon as I got to a place of having experience that I could share and potentially help other people, is when I decided to make that change. And so I dug in and kind of used it almost like a diary, sharing what I had been through, what I had learned, potentially advice or experience that could help somebody else, and just opening up about it. And there are lots of creators, I guess I would call them, on Instagram and other social media outlets that embrace their challenges and talk openly about them. And so for Health Monitor to be able to kind of connect those things together, to kind of connect a diagnosis with a face and with somebody who has boots on the ground, been putting one foot in front of the other, no matter how challenging, is so helpful.
Right. It's always helpful when it's coming from someone who's actually going through that condition, right?
And I find it very admirable that you're so vulnerable and able to share your story with others on social media. Can you tell me, through sharing your story and through your diagnosis, what's the biggest lesson that you've learned throughout this journey? And what's something that you maybe wish you knew a bit sooner on your journey?
I would say the biggest thing that I have taken away from all of it is that nobody isn't struggling with something. I am surprised when I talk to people time and time again. I'll hear, "Oh, wow, you're so easy to talk to or to connect with." And I feel like everybody has that capacity. It's just me acknowledging that a lot of what we experience with day to day is smoke and mirrors, and there is so much just real life happening behind the scenes with everybody. I've been in the modeling industry for a while, and the amount of effort that goes into setting up, a photo shoot and all that sort of stuff is insane. And so I know a lot of people who debunk like Instagram versus reality, kind of showing the behind the scenes is how everyone's life is. Nobody has it perfect, like those red carpet smiles and all that kind of stuff. There's so much real life happening behind it, and that's what I enjoy most, because it helps me connect with people on a more real level, and I enjoy that very much. So that is always the biggest takeaway, and it hasn't failed me yet.
Right. You never really know what's, going on with someone until, you really
Good and bad.
Yeah, you never know what's happening behind the scenes, right? I love that way of thinking. So what activities did you find helpful, in improving your mental well-being, through your diagnosis?
I actually am a member of Al-Anon, which is a 12-step program that's for friends and family of alcoholics. And so we, as members of that, I grew up in an alcoholic home, and I don't know how much that had an impact on my, beyond genetics. A lot of things are nature nurture. And so how much did a stressful, home environment have on my IBS? If I didn't go through that, would it have flared up the way that it did? I don't know. Regardless, the Al-Anon program has been very helpful, because as a result of that tumultuous home environment, I didn't have a great toolbox of skills for dealing with life. And so I struggled a lot. That group helped me to kind of have tools and a plan and support and resources for just dealing with life on a daily basis.
What's your favorite tool out of the box? Like what's, one of your favorite lessons that you've learned through the support group?
Yeah, the analogy of not going to the hardware store for bread. I would just, and currently still, go to the wrong place for what I'm looking for. So if I thought that I would get fostering from my parents, or if I thought that I would get straightforward answers from a doctor, I would be convinced of that and think, oh, okay, I just need to go back again and try again. Or maybe a slightly different approach, but keep going back to that same source that was not giving me what I needed. So changing my approach and going to the bread store for bread instead of showing up to the hardware store asking for bread like a maniac, helped me significantly.
Oh, no,
I love that analogy.
But I love that. I've never heard that before. I saw your cat walk up the stairs before, so I
Oh,
know you're a lover of animals. Have you found that your animals helped like be a kind of different support system to you?
yeah. I am a modern cat lady. Yeah, COVID was a whole thing. And talk about I have seen enough to know that, and this is probably a good message that I would share with somebody that is struggling as well. But denial serves nobody. Denial serves absolutely nobody. Catching something early is always better than too late. So preventative screenings, or like just going in for annual checkups and verbalizing health concerns is absolutely important. Like, health is wealth is not just a cliche. Like, it is real life, and it impacts us every minute of every day. So invest in it. My dad passed away from lung cancer 3 years ago. It was during COVID, but he was not impacted by COVID, fortunately. But still, the lung cancer did. And during all that time, the animals like saved me for sure. And I love love. I love giving love and receiving love. And the animals were a great avenue for that with me.
Your animals,
Yeah.
like I can't even tell you how much my dog has helped me in my life and like through so much. So and you did mention in your Health Monitor Living article that you have such a passion for helping animals, and that kind of translated to helping people. So I feel like you've kind of gone over that a little bit, but do you want to go a little bit more into depth on that?
I think I just like to help people. I'm kind of a caregiver by nature. I was raised or just took on the role of being a good helper. So where I can do that, I will. And animals are probably kind of one of those helpless situations where they didn't ask to be here. And especially with cats, they don't have to be registered like dogs, and so they're just kind of left to their own devices, and they just do what their biology tells them, which becomes problematic for us in neighborhoods and communities. And so I appreciate someone in a rough spot, because I've been there and I can relate, whether it's an animal or a person, and have an open mind and heart for what someone is dealing with, and what their feelings are surrounding it, because perception is reality. Nobody's feelings are not valid just because they look smaller compared to somebody else's.
100%. No, and I think that through sharing your story with us on your social media, helping yourself by like finding the right doctors, getting the answers that you needed to get, that is essentially helping others, because you're sharing your story of what helped you to help others. So I applaud you for that. And I think you're a really inspiring person.
Yeah,
thank you so much
for sharing your story. I'm sure, a lot of patients who are going through the same thing as you, find it validating to hear, someone, going through the same thing as they are, right? So I'm really grateful that you shared your story with us.
Yeah, thanks for the opportunity. And I just really want to empower people. It was a tough realization for me to come to, but whether or not I asked for what I have, it's my responsibility. So I've done plenty on my journey of finger pointing and thinking, you know, somebody else needs to help me with this, or like it's somebody else's responsibility to deal with this, and looking the other way, or blaming just did not get me anywhere. And assuming responsibility for oneself is very freeing. Obviously, support is super helpful, but it's not required. You have the power to keep moving forward on your own, and it's like it is my task to manage my own health and mine alone. So I just want to empower everybody to take a handle on that, and to do whatever you have to do to get support, or find people who will listen, or find people who will help.
I like that you know, that you take responsibility, that you acknowledge that, yeah, this is my own responsibility, but at the same time, you know, it's okay. It's okay to ask for help if you need it, right? Like, it's okay to, you know, seek support from your doctor, or like from a community and social media. So that's really good to hear.
And I think that's a great message to leave it on. And again, thank you so much, Carley, for being brave, sharing your story, and sending out a great message to others on their journey.
Thanks so much for the opportunity. I appreciate it.